for a nipple reduction, I'm assuming there's really no scar, right? You're just kind of making it shorter and
Exactly. You take like you can take a small wedge out, or you can take a little band around it, and then you put it back. Everybody can close their eyes right now and imagine how the nipple and areola areas are, and then the nipple area has many dents and prominences and wrinkly skin. So in reality, when you close it, and you close the way I like to close those repairs are still in different levels to decrease the amount of tension and obtain a good closure. But the scar, there will be a scar, but it's practically invisible. You can't see it because that scar fuses pretty well. There's the terrain is not very uniform, so you can hide it really well.
okay, now if we're doing an areola reduction, what kind of scar do we imagine and what do patients need to do mentally to sort of be like, okay, so I have this new beautiful breast that here's my goal. Where are my scars? How do I take care of them?
So the scar, when you're doing an areola reduction, goes basically around the areola, and it hides well. When patients say, "But I'm not going to have a scar, right?" So that we
Yeah, you
will
are.
have a scar. We will have it because, I mean, we're good, but not magicians. So as we are reducing, we cutting the tissue out. We need to have a scar, but as but we do it very precisely and around the areola. It will turn into the real border between lighter skin and darker skin, or whiter skin and pinker skin, to be able to be hiding. And I think by doing that, in reality, it's very inconspicuous down the road. You can still see it, you can still find it because the
Right.
scar exists, but
Mhm.
it's really hard to see.
And do you have any specific instructions? I mean, I would think the biggest instruction would be to stay out of the sun. Don't go nude sunbathing. Don't go to Europe
Exactly.
to Capri and like take off or in
The top.
France, wherever they do the topless beaches. Don't do that. But,
Right.
what are kind of the things to help women? Because I think we get obsessed with scars. It's silly, but we
Hmm.
do. And that trade off is that beautiful result in that goal that you want but like, what can we do to kind of make sure that we're going to have the best, that give our body the best chance to heal and make a pretty scar?
Yeah, well, and that's one of the things that I always tell my patients, right? Like when the first day out of surgery, the line is so nice, thin, and delicate, and it's incredible. But then, literally, after we finish, take off our gloves, then the patients take over for the healing part. And there's tips and tricks that all patients can do to decrease that scarring process or to make it in a better way. And we guide them through that process. We see them at one day before, 1 week after, 2 to 3 weeks after that, and then 6 weeks. And so we try to catch and see how that scar has continued to heal. And what we do is we recommend how to start the scar therapy, what things to apply. We actually provide for our patients what we believe is the best serum for scar care afterwards. So there's many things that we do for to improve the scar, and we ask them to not to be exposed to the sun, not to swim for the first 2 3 weeks, and of course not to go topless, as you were saying, when they're out in the
Showing off the
sun in the
girls.
first.
You
Exactly.
can
Not
show
they're not
off the
yet ready
girls,
yet.
but not quite yet.
Not quite yet. They're not ready.